Dr. Vishakha Modak. I hope I said that correctly.
Yes.
She is a junior resident at the Bangalore Medical College and Research Institute. Dr. Vishakha is an MBBS graduate who is currently serving the government by working as a junior resident at BMCRI, India. Thank you so much, Doctor. You graduated magna cum laude and you're not only interested in academics, but research. You love teaching and believe strongly that patient education is the most vital and crucial step in disease prevention. So at this time, I will quiet down and let you take over. Thank you so much, Doctor.
Hi, good morning to everyone present here. Like he gave a great introduction, but I would like to do a little bit of it myself. I'm Dr. Vishakha, and I'm a junior resident in Bangalore Medical College and Research Institute. And today's presentation that I am going to be giving is about understanding the pathology of diabetes mellitus, specifically type 2 diabetes mellitus, and also about certain uh, key points regarding diabetes self-care and diabetes management. So it's going to be a talk about all of this, and especially for the patients affected, the caregivers who take care of the patients. So I'm going to cover a few points that summarizes all of this. So my talk will be for about an hour, and at the end of it, I'm willing to take questions from all of you. So I hope I can start. So, understanding type 2 diabetes mellitus. So, let's get to certain facts about diabetes. Okay. I'm talking about the prevalence of diabetes that's present in the United States of America, and 11.3% of the population suffers from diabetes, uh, and that's about 37.3 million people. That was the latest statistic, which was given by CDC. And out of the pool of 37.3 million, 28.7 million adults are diagnosed, and 8.5 million people remain undiagnosed. So that's 23% of people remain undiagnosed. So, what exactly is diabetes mellitus? Diabetes is a chronic metabolic disease which is categorized by elevated blood glucose levels. So, it's chronic in the sense it lasts for your entire lifetime if you have it. And the whole in chronic conditions, what we usually focus most on is managing the condition. Uh, Great. There have been many studies which suggest that diabetes self-care and management can really go a long way in controlling the blood sugar levels. And it's very important why the blood glucose has to be controlled, as most of you are aware that diabetes just affects a lot of organs in our body, right? From the skin, you have increased chances of infection, you have, higher risk of atherosclerotic disease, uh, neuropathies, diabetic nephropathy, which is diabetes eventually, if unmanaged, can affect the kidneys, causing nephropathy. So that's why it's very important that in a chronic condition, we focus our goal on managing it at our level best, right? That's very important. So the classification of diabetes has changed, but broadly speaking, it's type 1 diabetes, type 2 diabetes, and gestational diabetes. So, gestational diabetes essentially means that this is a sort of new diagnosis that happens when some ladies experience this during their pregnancy. So, that's why we call it gestational diabetes mellitus. And then there is type 1 diabetes mellitus, which was referred to as insulin dependent diabetes mellitus, because the pancreas in this case are not producing insulin. Okay. But the type 2 diabetes mellitus was also referred to as independent or non insulin dependent diabetes mellitus. This requires insulin in the sense that the insulin is produced by the pancreas, but the cells stop responding. So the goal of therapy is not just replacing insulin or controlling the blood sugar levels, but also really making sure that the cells that are supposed to be responding to insulin do adequately respond on medication. So that's the whole goal. The goal differs in type 1 and type 2 diabetes mellitus, right? The goal is the same. We need to control our blood sugar levels, but the pathology of type 1 is very different from type 2. So, what is insulin? So, insulin is a hormone that is produced by the beta cells of our pancreas. And this hormone is extremely important for allowing the glucose in the blood to enter the cells. This is very important because each cell in our body requires energy to function, right? Every cell many cells form tissues, many tissues form organs. So the basic unit of any organ or organ system is a cell. And the cell, like, any of our vehicles, like they require fuel to drive them, like that, our cells require energy to function. And where does this energy come from? A lot of substrates, right? From sugars, which is glucose, all complex sugars are broken down into glucose, or fats and proteins. But the primary uh, fuel for our cells is glucose, right? So this glucose has to enter the cell. And what insulin does is it's a mediator. It helps the glucose to enter inside the cell so that it can be used up for generating energy. So, like I mentioned earlier, in type 1 diabetes, insulin is not produced, and in type 2 diabetes, the cells are not responding to the insulin produced. So, in type 2, the insulin is produced, but the cells have become resistant to insulin. They just do not respond. So essentially, what really happens is that although this insulin is present, the glucose is present in the blood, the cells are incapable of uh, absorbing that glucose to convert into energy. That's what happens in type 2 diabetes. So this is a pictorial representation of the same thing that I spoke about. Like, as you can see in the picture, there is a cell, the orange thing with the thing in the middle is the cell, okay? And there is glucose. Glucose is the pink tiny ball, and there is the yellow color peg-like structure, which is an insulin. So first, the insulin has to unlock the glucose channel. And once the insulin unlocks the glucose channel, it kind of opens a doorway, for the glucose to enter inside the cell. So without insulin, the glucose does not enter inside the cell, because of which the cells cannot use the glucose for making energy. And that's why, this is how I personally correlate. That's why many people who are with type 2 diabetes or type 1 diabetes, they do not feel energetic on most days. Like, they tend to feel very fatigued because the cells are not utilizing the glucose at all, because the cells are not responding to the insulin, which is supposed to unlock the channel for the glucose to enter and do its function, which is help the cells to produce energy. So this is again a pictorial representation of what insulin resistant really is, So on the right, you can see a structure uh, over the letters which say make insulin. Those are the pancreas. So the pancreas are producing insulin. The cells therefore resist insulin. So when the cells resist insulin, what really happens is that it's telling the body, it's telling the pancreas that, hey, we aren't getting any energy here, you know. So what the pancreas does is like, okay, I know you're not getting energy. How can I help? I'm going to produce more insulin. So as that happens, the pancreas produce more insulin every because your cells are resistant to the normal quantity of insulin that's being produced. And what we need to realize is that insulin just does not have a single function. The most important function of insulin is to allow glucose to enter the cell so that it can be used up for energy. But the other function of the hormone is storing fat. So this is known as, it stores fat. That's why the more insulin that's produced by the pancreas, because the pancreas believes that the cells are not getting enough insulin, more insulin gets released, and insulin is a fat storing hormone as well, which is why there's a lot of adipose tissue deposition or fat deposition that can occur when insulin is a lot more insulin is produced. But the patients usually feel very tired and hungry. Why? The reason for this is because the cells are not absorbing glucose, right? So that is the whole essence of type 2 diabetes, that the cells are tricking the pancreas by telling them, hey buddy, we we aren't getting any glucose. And the pancreas is like, okay, I'll produce more insulin. But the problem is at the cellular level. So these are the symptoms of diabetes mellitus, increased thirst, frequent urination, increased hunger. The reason for hunger, like I mentioned earlier in the previous slide, is that, the cells are fatigued. They believe that they don't have energy. So there's a lot of glucose in the blood. There's a lot of insulin in the blood, but the cells aren't getting that glucose to function. So it's very common to feel tired, and as a result, hunger also increases, right? And then there is blurring of vision, slow healing of sores, frequent infections, numbness or tingling in the hands and feet. And there are in certain people, there are areas of darkened skin, usually in the armpits and neck. And that's what we call as acanthosis. And that's a marker of insulin resistance. So, what are the risk factors for causing type 2 diabetes mellitus? There are many risk factors that have been found, and one of them is weight. Being overweight or obese is a major risk factor. The second one is fat distribution. So, the trend has sort of changed. There was a lot of focus on the BMI. I'm not saying that BMI does not matter or is a poor predictor of obesity, but the trend has sort of changed that now what we essentially are looking at is the waist hip ratio. So it's very important to understand what waist hip ratio is. So somebody with a larger waist to hip ratio is storing a lot of fat in their abdominal region, right? Which is why the numerator, which is the waist number, increases. And so this is a very important predictor of amount of fat that is stored in the abdominal region. Okay. Then inactivity. So the less active anyone is, the greater the risk of diabetes, because I'll get to why activity is so important. I feel like, there's a lot of uh, jargon, or that everybody should be physically active, but no, like I haven't heard anybody go into the specifics of why exercise is important. So I'm going to be covering that. There is a very particular reason why exercise is very important in case of patients who are affected with diabetes, but we'll get to that later in the presentation. And family history. So somebody whose parents, the first generation family, has diabetes, then not 100%, but the kids have a greater likelihood of developing diabetes compared to somebody's family where, the first uh, relatives or siblings are not affected. So people with a family history are at a greater risk of diabetes. Race and ethnicity, so certain races have higher prevalence of diabetes that's present. Other risk factors are blood lipid levels, the age, pre-diabetes, and pregnancy-related risks, like I mentioned, because gestational diabetes mellitus is something that occurs in pregnancy, where the hormonal changes during pregnancy sort of make the cells resistant to insulin. So, gestational diabetes mellitus, as the name suggests, is that the patient must not have diabetes prior to pregnancy. This is a condition that is very unique to gestation in the sense that insulin resistance sort of develops during the pregnancy. And then there is polycystic ovarian syndrome, very common in young females. The cause of this is also insulin resistance. The body cells are not responding to insulin because, and there are also other hormonal factors that come into the play while we're talking about PCOD. But one of the components in the whole PCOD spectrum is insulin resistance. So, what are the complications of diabetes? There is heart and blood vessel disease. Diabetes is a very strong predictor, is a very strong risk factor for development of atherosclerosis. Atherosclerosis is basically hardening of your blood vessels and narrowing of your blood vessels over time. Nerve damage, or what we call neuropathy, and kidney disease, what we call as nephropathy. There can be uh, the eyes can also get affected. This is what we call ophthalmopathy. So in this case, patients affected with diabetes are more prone to develop cataracts and glaucoma. Certain skin conditions like repeated fungal infection, oral candidiasis is something that we commonly see in patients affected with diabetes, and this is because it even alters the immune response. Diabetes really can act on our immune system in such a way that the patients tend to get a lot more infections. Uh, they're prone to getting these infections more commonly. And slow healing is also another feature that occurs in diabetes, and hearing impairment can also be a certain complication. So, when I am going to be talking more about diabetes self management, because this is a very, very crucial area in managing diabetes. Since it's a chronic condition, self management really goes a long way, because in case of self management, you as a patient are an active participant in managing your condition. And that is what I want to stress on, because since it's chronic, the damage sort of is done over time. It's not acute, it doesn't happen quickly. Diabetic neuropathy, nephropathy, all of these take some time to develop. And if the blood glucose levels are monitored and are kept in check at an earlier stage, it can really prevent these complications from occurring. So, self management is a very key component in managing diabetes. Earlier the start, the better, but it's also never too late, you know. So, this is a diagrammatic representation of what I feel self management should entail. All the pieces of the puzzle really should fit, because we're not just talking about actionable steps, adhering to medical management, but we're also talking about emotional well-being in case of patients affected with diabetes, because you essentially have to learn how to cope with the disease only and accept it on a certain level which is very important. Healthy coping is extremely vital because healthy coping is a way for, it's like a doorway to get motivated to manage the levels, the sugar levels. So this is like a pictorial representation, like I mentioned. It includes healthy eating, being active, healthy coping, medication management, and monitoring. So we'll go into detail, um, further into detail about each of these, but all of these are very important. So how can type 2 diabetes be managed? The first step to management of anything is understanding. Understanding the disease is very important, and this can take place at many levels. There are certain well equipped professionals called diabetes educators, so you can reach out to them and they would definitely answer the doubts, any queries, and make sure that the patients really understand what diabetes is. The second most important step is discussing treatment plans and different medications with the provider. This is very key because, like Dr. Raj mentioned in his previous talk, that the therapy of diabetes, is very individual. It's tailored individually. It might be the same disease pathogenesis, which is insulin resistance. That's the common denominator, but the varying levels of blood glucose in different patients clearly tells us that it's a very individualized sort of a disease. No, it's very unlikely that two patients will have the same blood glucose profile when they chart it at home. So the treatment has to be catered in a very personal way, in a very individualistic way. The third is staying active, which is important. I will get into how insulin really affects, uh, exercise really affects our body. And active participation in self management is very key. It helps us gain a certain level of control when we are actively participating in self management. And diabetes foot care practices are very important since diabetic patients are exposed to, frequent tiny hurt or tiny lesions becoming very large because of the poor and slow wound healing process. So, diabetes foot care should also be included in the management of diabetes. The next is managing blood lipid levels. Like Dr. Raj mentioned, that 40 to 75 years of age, all the patients must be started on either low dose statins or high dose statins, depending on the risk, the 7-year risk that we call. If it's greater than 7.5%, high risk statins, high dose statins are started. If it's lesser than 7.5%, low dose statins are initiated. But managing blood lipid levels is very important to prevent cardiovascular complications of diabetes. The next step is glucose monitoring or charting. Glucose monitoring and charting is important because it's not an individual number that we're looking at. It's a trend that we want to monitor, over a long period of time to tailor the best treatment for the patients. So glucose monitoring and charting is important because, we as doctors aren't physically always around, nor do we know your charts perfectly. So when somebody monitors their glucose over a long period of time and shows us a log logbook or a home chart, we can actually understand the whole trend of glucose levels, and that is important to tailor the treatment regimen. And lastly, but not the least, this is a very important uh, tool is quitting smoking. It's it can be hard for a lot of patients, but it's very vital as to why quitting smoking helps or aids in diabetes self management. So, what are the obstacles in coping with type 2 diabetes mellitus? Um, Anxiety and depression associated with coping with the disease. There was a study done which mentioned that these were the highest prevalent psychiatric conditions in patients affected with diabetes, or the most prevalent diagnosed conditions are anxiety and depression. In the older adults, there is a lot of distress because they have to adhere to medication use and complex treatment plans. Then another obstacle would be self-monitoring, fear of injections, uh, lack of motivation, level of education, because not everybody is in a place to understand, unless you read and you talk and you communicate with your provider. uh, it's very important to educate yourself regarding diabetes. And lastly, making changes in lifestyle. These are the most common obstacles that we see among patients affected with diabetes. Sometimes it's just one of these, like not able to adhere to medication use, but sometimes it could be two or three obstacles that, sort of come in the way of uh, the treatment plan. So, this is a pictorial representation of psychological factors in patients with diabetes. So this is showing us the different levels of emotional distress that happen in patients with diabetes. So it's the psychological reaction of patients who are affected with diabetes. Not all, but like I said, it's a spectrum, right? So some people, the first picture that you can see is emotional crisis or reactions. When a patient is first diagnosed, he might be shock, denial, anger, might even feel a certain sense of guilt and anxiety regarding the condition. Then, so common emotions faced by the patients are denial, anger, guilt, and acceptance. So going back to this slide, there is also diabetes associated distress, like feeling overwhelmed, especially when it comes to self-management. This is most commonly seen in the older population. Frustration, difficulty in communication, and distress on differential food treatments in the family. You know, then there are phobia reactions that can occur, like fear of starting medication, fear of needles and injections, fear of hypoglycemia, and other complications. So these are the phobia reactions. And lastly, the diagnosed psychiatric disorders in patients with diabetes are depression, anxiety, delirium, eating disorder, and schizophrenia. So this shows us that, poor glycemic control, uh, to improve the glycemic control, self care behavior and treatment adherence is very, very important. And because if this is not addressed, then the quality of life of the patient really decreases. So, self care, healthy coping are cornerstones apart from the medication in the management of diabetes. So, I covered this slide. The most common emotions faced by the patient are denial, anger, guilt, and acceptance, finally. So, if you catch any of your family members, or if you're a caregiver, or even as a patient, if you hear any of these phrases, like one bite won't hurt of the dish that you really want to eat but can't because you're on a strict glycemic index control diet, or the sore will heal itself. So I came across a patient, and the patient back in India, he had an ulcer, and we spoke to him and we told him that, you should wear appropriate footwear because the hurt could be very small, like in a non diabetic patient, if they get hit somewhere or their nail chips off, very less chances of it becoming major. But in patients with diabetes, because of poor wound healing, what essentially happens that even a small lesion, like even a tiny rock, scratching the sole of your foot can become worse. So it's very important to uh, address this. Even phrases like "I will go to the doctor later," missing scheduled appointments with the provider, "I don't have time to manage my diabetes isn't serious, most people have it, you know, all of these are common phrases. And it's very important that denial is first stirred out, you know, and to recognize how denial sounds to gain better access to care, you know. So anger is another common emotion. What I really suggest is that as a caregiver or as a patient, if you do feel angry, it's very important to sort of understand the root cause of anger. You know, is this anger towards myself? Is this anger stemming out of guilt? Is this anger stemming out of, the overwhelm that I have to do so much to manage my disease? Or is it an anger towards, the loved ones because they really can't relate to what I'm going through, or towards the caregiver? So it's important to understand what's making um, you angry, and when that happens, uh, slowing down a little bit, taking a light walk, breathing deeply, drinking enough water, hydration is very important, and communicating your feelings in a healthy way if you feel like, or even journaling can really help manage anger. Like I said, there are phobias also that are associated with diabetes apart from anxiety and depression. One of them is the fear of needles and injections, or fear of insulin initiation and hypoglycemia. Although insulin is the mainstay for the management of diabetes, non adherence to insulin is most commonly observed in patients. And the reason for this is phobia. So, why is addressing the psychological well being of the patient important? Because certain studies have observed that by addressing psychological needs, there's an improvement in the HbA1c levels by zero point 0.5 to 1% in adults with type 2 diabetes mellitus. So, it's very important that psychosocial well being is also addressed while managing diabetes. And moreover, physicians believe that psychological problems are associated with worse outcomes. So there are certain guidelines that have been provided to ensure that proper psychological support is provided to the patients, and managing the negative emotions well when they arise in the patients living with diabetes. It's very important. So it's important to manage ABCs. So, what are the ABCs? So, one, A stands for A1C levels. So, A1C, HbA1c is a good marker of average blood sugar levels over 3 months. So, the goal set for many people is less than 7%. But what we're really trying to understand in this condition is that the goal can also be variable among different patients. And this is a very tailored goal that you have to make with your provider. Setting a goal is very important because once you set a goal, you automatically will have the interest to actively participate in your disease management. And it feels really good, to know that your blood glucose levels and A1C levels are in control because of the little steps that you have taken to help manage the A1C levels. And it's very important that everyone talks to their provider or their endocrinologist and make sure that they set a goal for themselves. Blood pressure is the second one. That's the B in the ABC model. So blood pressure is a confounding factor for causing heart disease. So the goal is very important, that the blood pressure levels are less than 140/90 for most people. Cholesterol levels, LDL, or what we call as bad cholesterol, it contributes to atherosclerosis and cardiovascular disease. What we call HDL is the good cholesterol. So HDL removes the bad cholesterol from the blood vessels. So getting that balance right, lowering LDL levels, it's raising HDL levels. This is very important because heart disease is a common complication of diabetes, like I mentioned earlier. And we want to make sure that the lipid profile is at least taken care of, to prevent the onset of such complications. And smoking. So if you smoke or catch a loved one smoking or using tobacco products, steps have to be taken to quit smoking. So what is HbA1c? So the sugar. So what are the HbA1c levels? So the sugar in the blood that's present is known as glucose. So when glucose is present in the blood, it ends up binding to the hemoglobin. Hemoglobin is it's it makes up the red blood cells, you can say. So HbA1c is a marker of glycated hemoglobin. It's essentially saying how much of hemoglobin is bound to this glucose that is floating around in the blood. So the A1C test measures how much glucose is found, and it's a good predictor of the glucose levels that are there in the blood. Excuse me. So HbA1c level is very important because it's giving an update over a long period of time. It's telling us how the blood sugar level range has been over the past 3 months. Because, like I said, hemoglobin is a compound present in the red blood cells, and the average lifespan of a red blood cell is 3 months. So HbA1c levels are going to give us greater information about the trend of glucose levels over a period of 3 months. So this is a pictorial representation of HbA1c. The normal ideally is less than 5.6. Pre-diabetes, the HbA1c levels are between 5.7 to 6.4. And for diabetes, the cutoff is usually 6.5 or 7. So, like I said, emotional well-being plays a very important role in self-care. So, negative thoughts and feelings, can affect how you view yourself. So, it's very important that active participation by engaging in healthy coping practices is very important to manage the emotional side of diabetes. So, what are certain healthy coping activities? One is being physically active, meditating, finding a hobby, joining a support group, writing in a journal, participating in faith based activities. These are some of the ways in which healthy coping can be exercised. What is unhealthy coping? Smoking, overeating, binge eating, not finding enough time for activity, avoiding people and social situations because of stigma or fear of being judged, drinking alcohol, taking drugs. These are certain practices which we can refer to as unhealthy coping. So it's very important that healthy coping is introduced while diabetes is being managed. So here are some strategies to use when feeling frustrated or overwhelmed. Start a conversation. This is very important with the healthcare team. It's very important to start a conversation and get the doubts cleared. So tell them what is causing the most concern for you when it comes to care. Talk about your emotions, uh, about your meal plan, the stress levels, the sleep hygiene, medications. It's very important to talk about all of this. Tell your healthcare providers or your care team about what you find hard or frustrating about the concerns mentioned above. Is it that sticking to a complex treatment regimen is hard? Or are you experiencing side effects of medications? Is there any phobia? Is there any guilt? It's very important to communicate what you're finding hard, so it's easier for the provider to talk it out and collaboratively work on finding a strategy for uh, managing the blood sugar levels. And it's important that you describe your thoughts or feelings about your concerns. Labeling the feelings sometimes does help. Find a support group. So support groups are very helpful because these are a very nourishing open space where you can talk about your feelings and emotions in a non-judgmental space without the fear of being judged. It's very comforting to find people who can relate, and it's a common ground for motivating one another. So find a support group. The next thing that I would like to talk about in self management of diabetes is healthy eating. So, the American Diabetes Association offers a simple method of meal planning. The method is described in the pictorial form. In a sense, it focuses on eating more vegetables, such as spinach, carrot, tomatoes. These are non-starchy vegetables. So half a plate should be full of non-starchy vegetables. A quarter of the plate must be full of proteins such as tuna, lean pork, or chicken. Another quarter should be filled with carbohydrate foods. But there are certain carbohydrate foods that do not spike up the blood sugar level very quickly, such as millets, brown rice, um, and if you have heard of something called fox millet. So all these millets are carbohydrates, but they are complex carbohydrates. They're not broken down into glucose very easily like our flour. So, these can be a good carbohydrate option. And lastly, have a fruit or dairy and a drink of water or unsweetened tea or coffee, like a 0-calorie drink. And it's also important to use good fats in the plate, like avocados or a handful of nuts, like pumpkin seeds, chia seeds, sunflower seeds, or even hemp seeds are a good source of protein. Uh, seeds are a good, some certain seeds are a good source of protein, but also a very good source of good fats. So, diabetes diet, healthy diet and wiser food choices start with planning. So, it's very important to plan the diet and sticking to the plan, and planning can go a long way. So it's important to find a registered dietitian or a nutritionist who can really understand the goals of your therapy and can work collaboratively with you, to come up with a diet plan based on your health goals, tastes, and lifestyle. And it's very important to talk about portion sizes that suit the needs for your size and activity level. And what are the essential components of diabetes diet? So a diabetes diet is based on eating 3 meals a day at regular times. This is important to sort of tune the insulin response, to make sure that you get used to the insulin that your body is producing or gets through medication. So timing the meals is also very important. So what is glycemic index? When we come to diabetes and food, especially, the word glycemic index, or GI, is spoken about a lot. So I just want to simplify what it means. So the glycemic index is a value used to measure how specific foods increase blood sugar levels. So foods are then classified as low, medium, or high glycemic foods on a rate of 0 to 10. So this is a graph that describes what high GI and low GI foods do to the blood glucose levels. So high GI foods spike up the glucose levels very quickly. Low GI foods spike up the glucose level, but in a very slow fashion. So it's not like going up and down quickly, it's tapering down slowly. Um, so the GI ratings are low, which is 55 or less, medium is 56 to 69, and high GI are 70 and above. So what we're trying to say is that low GI foods are vegetables, non-starchy vegetables. So these should occupy more than about half a plate. Medium GI foods could be certain lentils. That's why proteins are important in the diet. High GI foods are sugars or carbohydrates or flours or chocolates. They spike up the glucose level very quickly. Since diabetes is also associated with uh, foot and foot related complications because of poor wound healing, osteomyelitis, and ulcers, foot care is an important step in the management of complications of diabetic foot. So check your feet every day for blisters, any calluses, corns, for any redness, swellings, or cuts. And why is this important? Because unmanaged blood glucose levels, like I mentioned earlier, can affect the nervous system and cause something called diabetic neuropathy. And as a result of which, patients feel no pain. So when you feel no pain, you don't know if you have been hurt in any way, if there has been a prick. And as we know in diabetes, because of the poor wound healing, the prick can even become a big lesion. So it's important that certain signs are picked early on to avoid a larger lesion. So it's very important to check your feet every day for blisters, calluses, corns, any redness, swelling, or cuts. So this is a checklist that I have made. It's called the diabetes foot care checklist. So firstly, wash your feet every day in warm water, not hot water. After you wash your feet, dry it completely. Make sure it's not moist because that can give moisture can give rise to fungal infection. So make sure that the feet are dry and apply lotion to the top and bottom, but never between your toes because between your toes, the area has a lot more moisture compared to the above and below surfaces, and it can lead to tiny pockets of infection in these areas. So it's important to dry the feet and apply lotion on the top and bottom. Third important part of the checklist is never go barefoot. And always wear shoes and socks, or socks even while wearing slippers in the house. It's very important to wear socks to avoid injury, because even tiny pebbles or any other tiny objects inside the shoes or on the floor can really cause a lesion that can turn big. So, fourth important point is always sock your shoes and slippers. It's very important. It's tempting to kind of remove the constant calluses on your own, So, I strongly suggest not to do that. And also not to use over the counter products to remove them, as they could burn the skin layer. Get it removed by a trained podiatrist or a trained provider, but don't attempt to remove corns or calluses by yourself. Wear shoes that fit well. For the best fit, try on new shoes at the end of the day when your feet tend to be the largest, but break in your new shoes slowly. Wear them for an hour or two, until you're comfortably settled, until you're comfortable, but wear shoes that fit well. So, when to see your provider? These are the common points. If you notice any of this, it's best to go to your provider. Any tingling, burning, or pain in your feet, loss of sensation of touch, loss of sensation of heat or cold, a change in shape of your feet over time, pain in your legs while walking, or cramping in the buttock region or thigh region or calves during physical activity. If you notice any dry skin on your feet, a change in the color and temperature of your feet, thickening of yellow toenails, uh, ingrown nails, any blisters, sores, ulcers, infected corn, any fungal infections between your toes. All of these are certain key pointers to look out for. And if you notice any of this, it's better to visit a podiatrist or a provider before things get worse. Being active is one of the most powerful tools for managing diabetes. Physical activity helps control blood sugar levels and lowers the risk of developing diabetes related complications. So, there's no pressure in the type of activity you choose. You have to be an active participant in your self care, and that really means that you have to choose an activity that you enjoy, like yoga, cycling, dancing, or spending time with your partner or your children, or being active at the gym. You tailor the kind of activity that you want to perform, and set goals. It's very important to set goals, which is uh, essentially to manage weight, you know. So, not just that, but also the goals are initiating a certain sense of accountability. And when you naturally are more accountable, it translates into better management of the condition. So, the big question, this is uh, very important as to why exercise helps in glucose absorption. So, as you can see in the figure on the left, the yellow color dots are the glucose in the blood. Insulin is binding to the blue color peg like structure and kind of opening a gateway, called the GLUT4. It's insulin binding to its receptor on the cell surface, kind of opens the GLUT4 channel, and GLUT4 channel allows the glucose to enter in. So, GLUT4 requires the cell to bind to insulin to let the glucose in. It's like a passcode. You want to enter a room, but it has a private passcode. So the only way you can enter the room is if you know the passcode, right? So, or somebody inside the room lets you in because you know the passcode. So, uh, passcode is essentially like insulin. Somebody inside the room is the GLUT4 channel, and you are the glucose. The ultimate goal is for you to enter the room. But why exercise is very helpful is that it's the only state in which the GLUT4 channels open up and allow glucose to enter in without the need of insulin, without the need of insulin to having to bind to the receptor. So it's very important that exercise is a part of your regimen because you're increasing the cell sensitivity to glucose without having to need insulin to do that. What is the optimal exercise that's required per week? According to the AHA, it's 150 minutes per week. So setting goals is very important in management of diabetes mellitus and its complications. So working with a doctor to determine what level of physical activity you should engage in. This is also very important because certain comorbid conditions, high intensity training is generally not advised. So speaking to your providers, since they know your history the best, can communicating them with them and asking them what activity is good for me or can I engage in this is very important to know. Figuring out how much time per day you can devote to exercise, setting goals, because once you have clear goals, you are more accountable and you constantly stay motivated. And consider actionable steps. Would you like to work out in the gym or in the neighborhood or in a park? Find the workout that makes you happy. It's very important. And build different activities in your daily routine. And it's important to start slow. It's not mandatory that you rush into something that you aren't ready for. So start slow, be patient with yourself, and allow time for recovery. It's okay to take rest days. You don't have to work out 7 days a week, but try reaching the 150 minutes per week target. And keep track, it's very you can have an accountability buddy to keep track of the goals that you want to meet and the progress you're making.
Thing. Both mother and daughter were.
It's also important that you speak about your medication regimen and your treatment regimen with the providers, asking them questions openly regarding the treatment plan, the blood glucose target levels, the side effects of any medications is very important in having a collaborative approach to managing diabetes. The next cornerstone of managing diabetes is benefits of glucose monitoring. It's very important to monitor the blood glucose level trend, like I mentioned, since diabetes is a chronic condition. Kind of seeing the trend of how the glucose levels are is very important to tailor medication, tailor the food, that you're eating, and sticking with a healthy eating pattern. To stick with a healthy eating pattern, you need to, we as humans want evidence, right? So the evidence speaks for itself. If when you're eating healthy, if your blood glucose levels are in control, if they're not spiking up, it's a reward mechanism for your brain to want to do more of that. Being able to check your medications and what impact new medications have on the glucose levels, being able to see overall trends and have a positive outlook, when the blood glucose levels are in range, and lowering your risk of high or low blood glucose by having actionable information. So it's important because in diabetes, certain complications of diabetes are hypoglycemia or hyperglycemia, ketoacidosis, and these happen because of either ketoacidosis occurs because of very high blood sugar levels, and hypoglycemia occurs because of very low blood sugar levels. So keeping a track of your blood sugar levels essentially helps you monitor these type of unforeseen situations. So once you rush to the ER, if you have a blood CGM machine and they can see that the trend or they can see the last blood glucose level, it's below 50. If you're hypoglycemic, they can start an infusion, a glucose infusion or dextrose infusion. So it's important to monitor the blood glucose levels. So there are two kinds of monitoring. One is continuous glucose monitoring. Is a sort of a machine that tracks the trend of the blood glucose levels. And the second one is blood glucose monitoring, which is the finger prick method. But there is a good amount of transition that's happening where patients are opting for continuous glucose monitoring, as this reduces or the chances of phobia that are associated with needle stick or injections, and it is less invasive. So self-care tips for caregivers, because managing diabetes is a collaborative effort between the patient, the doctor, the support system, or the family, the caregivers. So it's very important that I address the self-care tips for caregivers. So a caregiver should also seek social and emotional support when needed. They should reach out to a therapist or join social support groups where they can discuss about their thoughts and emotions in a open, non-judgmental space. They should receive or update their caregiver skills training. Education about the condition or conditions the person you care for is living with is also important. And activity planning for you and your care recipient is also important. Any fun activities, just to sort of break the mundanity is important. And you could also redesign the home environment to make the caregiver's task easier. And it's a beautiful job, having to take care of patients with diabetes, and to do it uh, with so much motivation and dedication every day. It's very important that you take care of yourself as well, by reducing your stress levels. Yoga, meditation, um, any physical activity can help with this. Accepting that you're doing the best you can is also very important. And talking and communicating your feelings when you're overwhelmed with a professional or a trusted friend, that's very important. Taking care of your own health, eating healthy, having a good sleep hygiene, sticking to your medication plan if you are taking any medications for any disorder is important, and following a healthy lifestyle overall. So this is for all of you guys that I made, that you're a winner every day. There is no one day that you're going to wake up and be like, oh, today is the day that I excelled. You know, managing diabetes is a daily process, it's a step by step process, it's a lot of baby steps. And each day, each one of you is a winner for me. In case nobody told you this, all of you got this, by attending seminars as such, or educating yourself, talking to your providers. You are doing the first step that's required in managing diabetes. Thank you all for listening.
Thank you so much, Doctor. Wow. That was absolutely fantastic.
You're
Coming
welcome.
from India. Yes.
Yeah.
We sure
You're welcome.
appreciate you.
Yeah, I'm so happy to help.
Thank you again. All right, Jasrina, you want to make your way up here?
Anyone has any questions?
I don't believe we had a question. I checked chat and everything.
Okay, sounds good.
Thank you again, Dr. Modak.
Thank you so much.